Hi there, I am Brianna Bradford, and for this presentation we are going to talk about the importance of interprofessional collaboration in healthcare. Interprofessional collaboration is defined by the World Health Organization as multiple healthcare workers working together with different specialties, and they work with patients and families to provide comprehensive and quality care. In the picture you can see why interprofessional collaboration is important. Each specialty has a different focus of a person, and combining these different skills helps to lead to reliable healthcare to improve quality of life. The ECRI Institute focuses on applied scientific research to improve patient care. In 2017, this institute found 3 different healthcare concerns that are impacted by interprofessional collaboration. These include unrecognized patient deterioration, behavioral health care issues, and test results and reporting and follow-up. Unrecognized patient deterioration can happen quickly. If the interprofessional collaboration is poor, then patients can suffer. For example, if a nurse recognizes there's a decline in a patient at the bedside, their job is to notify the medical doctor. If they don't come or answer back in an adequate time, the patient's quality of life immediately continues to deteriorate. There have been improvements made in the hospitals to help prevent this miscommunication. Rapid response teams have been initiated. These teams include a critical care doctor, a nurse, and a respiratory therapist. They come and they make decisions for these inpatients to help them get the care that they need. A second concern in 2017 was behavioral health issues in a non-behavioral health setting. There can be many issues with interprofessional communication in healthcare because every area is specialized. There are stigmas that regard behavioral health patients. Sometimes medical teams do not know what works best for these patients, and many mental health diseases will directly impact your teaching or planning for a patient. Therefore, medical doctors need to collaborate with psychiatry when necessary. Test result reporting and follow-up care can be improved through interprofessional communication. When a patient seeks care, doctors and nurses need to see the old medical history and test results to help guide their next steps. The delay in care will occur if they have to start from scratch. Also, follow-up care needs to be congruent. In order for this to happen, we have the electronic medical record, so every discipline can see what is being completed and needs follow-up on. The World Health Organization recognizes a need for a framework in collaborative practice among healthcare disciplines. Collaborative practice is utilized when there are multiple people from different teams that learn together in the same class, such as medical doctors, nurses, physical therapy, and these nurse educators can help play an important role in teaching them. In regards to the 3 healthcare concerns mentioned, nurse educators can come up with educational programs on how the nurse can be professionally involved. Advocacy for patient safety is a main priority for nursing, but it needs to be done in a professional way. To prevent unrecognized patient deterioration, simulations can be used to teach multiple disciplines what went wrong and a correct scenario to show what can be done to prevent these mistakes. In regards to behavioral health, nurse educators can be role models in reducing the stigmas that are in the mental health world. And finally, the test result reporting and follow-up care. Nurse educators can be clinical nurse specialists who are transitioning care and help educate the patients on the significance of following up. In general, nurse educators will be able to educate new nurses and student nurses through the use of interprofessional simulation to facilitate teaching of real-life scenarios. Case studies can be brought in for students as well as nurses and that have more questions on continuity of care for them to practice. The proposed evidence-based change is to hire an experienced nurse with a master's in nursing education to be a care coordinator for the ED, emergency department, with patients 65 and older. The care coordinator will help with the transition from the ED to home, and this role will be a nurse who is active in the interprofessional care team. He or she will be the patient's advocate for medication reconciliation, discharge planning, and teaching. One of the main priorities of this role is to communicate with patients, ED providers, RNs, LPNs, physical therapy, and social work members. These team members are part of a committee specifically for this new intervention. To keep it going, these team members are already collaborating in the ED setting. However, the ED is a large place with multiple areas such as nursing and social work who are stretched thin. Having a discharge coordinator on the team will provide an easy flow for patients, and they can have more time spent with them for their discharge instructions. As a member of the interprofessional team, the nurse can lead as a patient's advocate, collaborator, and educator. Bell recommends to access the interprofessional collaborative practice competencies to determine how effective the team is. Next, you can assess the communication within the group during interprofessional rounds and briefings. A nurse educator can identify gaps between the competencies and actual practice on the unit. The nurse can lead a meeting and address how these practices may have led to negative patient effects. After initiating new plans to improve the collaboration to mimic the competencies, a nurse can manage to ensure compliance. One of the many benefits of being a nurse is the closeness and the rapport that is developed through patient care at the bedside. The discharge coordinator that's hired will be identified as the glue between the patient and the healthcare team. This is a major benefit to have this discharge coordinator be an active role in the interprofessional care team with a background in nursing education. The patient-centered outcomes for my evidence-based proposal include reducing readmissions, lowering patient time in the waiting room. The population will be seen by the discharge coordinator within 2 hours of arrival, and 50% of the patients will be contacted within 24 hours of being discharged. Some strategies that will help achieve these outcomes are conflict resolution, communication, leadership, such as having a chair and co-chair for meetings, and a shared decision-making process. There will be an interdisciplinary committee with members committed to the meeting monthly to roll out this project and follow up with it. The committee will need interprofessional skills, such as the ones listed above. Conflict resolution is important for coming up with the plans for patients, and along with this, communication skills are needed. Having a co-chair and a chair keep the meetings on track so that all the disciplines can be heard is going to be important. Shared decision-making process is also necessary for the continuity of care for these types of patients. There are main communication skills that will be taught and enforced to ensure that there is effective communication. Active listening is one of them. Assertiveness, respect, positive feedback, and timeliness. Elsevier also confirms that within the team there should be timeliness because the response with positive and constructive feedback. There should be an order in which the meetings run so that every disciplinary team can respond and speak. All of these characteristics can be obtained through a specific training called Team Steps, as you can see there. This education is already required for the staff at the hospital where the proposal will take place. In summary, the key to healthcare is to have successful interprofessional collaboration. Interprofessional collaboration will help prevent unrecognized patient deterioration, behavioral health crisis in a medical world, and continuity of care as patients receive results and education unfollowed. Nurses' role in the collaborative team is vital since the role has the closest rapport with the patient, and including the patient in their care is very important for transformation of healthcare. Nurse educators can be change agents that start the discussions early on in nursing school with students about how to communicate effectively and collaborate respectfully. The nurse leaders and educators can be on these committees with the providers to help make collaborative, assertive decisions for better patient outcomes. As medical professionals collaborate with the team and involve the patient, people will feel holistically cared for and will have better health outcomes. Thank you for listening, and these are my references.